Hi, Mount Vernon. This is Mayor Shawyn Patterson Howard, and I'm just here for a quick Tuesday update with Shawyn. Just a quick Tuesday update. So please take a moment to share this video. Share the video. We're just going to talk a little bit about COVID. We're going to talk about gun violence in the community, and then give you just a few community updates on some things that are happening here in Mount Vernon this week. So please, if you just take a moment to share this video, it would be greatly appreciated. And we're also waiting for just a few people to come online and live. Okay. All right, so happy Tuesday, everyone. Just going to start out with a few quick COVID updates on what's happening with coronavirus here in Mount Vernon. We didn't get numbers for a few days, and so I believe the last time I came before you, I gave you the numbers of 2,111. So today is the first time we got numbers in a few days. So we are catching up with the backlog of numbers. So right now our cases sit at 2,468 cases, 2,468 cases. We have 24 new cases that have been reported, which is a little bit of a decline, so we're glad to see that. 2,468 cases are spread out over the city in 1,400 locations. And so this is definitely something that is widespread throughout the city of Mount Vernon. We do have a breakdown by zip code, but please understand the 10550 zip code is our biggest zip code where the most people live. And so this is kind of in line. In 10550, we have 1,361 cases, 1,361 cases. In 10552, we have 704 cases. And in 10553, which is down near the Heights, we have 403 cases. So that's our smaller zip code. 10552 is our second largest zip code, and that has 704 cases. And our largest zip code is 10550, the most densely populated part of our community, which has 1,361 cases of coronavirus. So it is very widespread, and I think it's pretty much balanced based on the number of people that live in those different zip codes. So while 10550 has the most cases, it also has the most residents living in the neighborhood. We continue to see clusters grow, and when I talk about clusters, sometimes we're talking about 10 cases or 15 cases. Those are in apartment buildings and at our nursing homes. So when we were speaking to you on last Thursday, we talked about the number of cases growing in apartment buildings, and that continues to happen. So we're asking you to please, if you live in an apartment building, if you're visiting apartment buildings, when you go into your lobby, you're still not in your apartment yet. So you want to make sure you're wearing your gloves or wearing your mask. You want to make sure that as you're opening door handles that you have a covering or a barrier, even if it's a paper towel, but preferably a glove to use to handle those doors, because the virus can live on doors and surfaces for several days. So you want to be careful. Even if they sanitize every day, you don't know if they've sanitized in the last half hour. So you want to use gloves. You want to use gloves near your mailboxes and your laundry rooms, on the elevators, when you go to the trash compactor, in any of the common areas of your building. You want to continue to wear gloves. We've put in each of the buildings, and most of the building management has put information up in their buildings about coronavirus and the spread of it. So you should expect your building to have some type of information in the building about how to prevent COVID in your apartment building. Please look for that information and be sure to follow those guidelines. But please remember, until you get into your apartment, that you still have to keep your guard up, because the common areas of your building are not as well protected. And even in your homes, you still want to make sure, as your family members are going in and out and visiting different places during the day, that you're paying attention to your symptoms, and that you are still trying to, even protect yourself when you're at home with your family. There are a lot of people who carry it that are asymptomatic, that may not know that they're COVID positive, and they could infect someone else who has a much greater reaction than they do. So you just have to be careful. You don't know. Mount Vernon Hospital is at 53% occupancy right now, so they do have beds. They continue to treat people with COVID. Mount Vernon Hospital, we are talking to them about opening up a testing center, a walk-in testing center. They're not necessarily using the tent for anything else right now, so we're talking to them about opening up that tent and having a walk-in testing center at Mount Vernon Hospital as well, where you don't have to necessarily make appointments, but that you can come in there, and if you're interested in being tested, that you could be tested. Mount Vernon Neighborhood Health Center continues to provide testing. You just have to call the 1-800 number and schedule an appointment to be tested at the Mount Vernon Neighborhood Health Center, but we want to make sure that we have multiple places throughout the community where people can be tested. Right now, about 17% of the people who are testing at the health center are testing positive. So they've opened it up for more people to be able to be tested. So people continue to test positive in our community. While we look at the governor every day, one of the things that he says is that this is not over. We are still dealing with COVID. As I move throughout the community, I've noticed that people have taken on their masks because they've also taken off their coats, and everyone's ready for the warm weather to come, but that doesn't mean that COVID is going away. We still have to make sure that we stay up on our social distance practices, that we continue to wear our masks, that we continue to protect ourselves. We have worked very hard to, contain and maintain decent numbers here and reduce the infection rate here in Mount Vernon, and we have been doing a good job, especially once we knew what was happening. We are sanitizing a lot of the public areas. We continue to have our social distance task force out there. We can't make everyone wear a mask at every moment of the day, but we are absolutely out there trying. There are some people who don't care, and regardless of how much education you give them, they're not going to continue to have practices, but we continue to push the message. We continue to check on businesses to ensure that they are following up and dealing with proper practices. And like I've told you before, our task force and our police department cannot be everywhere. So if you go into a business and you don't feel safe in that business because they are not using proper protective equipment, let them know that you are leaving, you are not going to do business there, and tell them why you're not doing business there. Because the power of your dollar is even bigger and stronger than us writing a ticket against a business owner. So you need to let them know why you're displeased with the business and why you're choosing to take your business elsewhere. Antibody testing is being made available. So what is antibody testing? If you've been exposed, or if you've had a sickness, or if you've had a vaccine for a sickness, your body will develop antibodies. It means that it's developing part of the immune system to help you be able to fight off the virus. So antibody testing is being made available in the county for our first responders and then essential workers. But antibody testing is being done different days. You might see them over at Stop and Shop or at Food Town. They're going to be popping up at different places. It is really important to get antibody tested, even if you haven't had COVID or you're not sure if you've been exposed. If you get tested and you test antibody positive, then it says that you've been exposed to COVID, or you might have even had COVID and it could have been a mild case. So I did it at Stop and Shop. I went and took a antibody test at Stop and Shop one day when the state was doing it there, and I tested positive for the antibodies. I went back and I looked and I tried to figure out, okay, where was I exposed? Was I sick, and what was I feeling? And I do know there were a few days that I was experiencing headaches and, like burning in my throat and a little pain in my chest. I just thought it was stress, because it wasn't the typical symptoms of fever and tiredness and having a hard time breathing, and it wasn't those typical, no body aches and things of that nature. But somewhere along the way I was exposed, and I developed the antibodies, which will now protect my body in case I'm exposed again. I won't develop such a strong case. So it's really important to know your status. So Please, if you see antibody testing being made available, it's just a simple procedure. I got a finger prick. They squeezed out blood on 2 blots of paper, and I was able to get my results texted to me in about 3 days. And so, you know, you don't have to run and sound like, oh, the mayor had COVID. Look, I tested antibody positive. I didn't have typical symptoms. I continued to move about. And even when you saw me in public, I always had my mask on. So, you know, I always tried to move responsibly, whether I felt I was sick or I was not sick. I wanted to make sure that I protected myself and that I was protecting people around me. So that's kind of where we are on COVID. Another thing that I want to talk about right now is, you know, we had a show on this past Sunday, with our police commissioner, our Lieutenant Krista Mann, as well as a few other NYPD retired officers, because we've experienced some shootings. We've experienced several shootings in the month of April. We know that on Palm Sunday, we had the double murder suicide involving the family. Clearly, that's a case that's closed and provides no further public threat. But we had that. That's something that traumatized the community. We had a shooting on First Avenue. That case was solved. That was a homicide, and that case was solved. It was a domestic issue. We had another shooting about a week and a half ago on 3rd Avenue. It was Sunday before this Sunday on 3rd Avenue, just a few houses up from my house. Again, those were roommates, and that was a domestic situation. And we have the suspect in custody. So that case was solved, and they'll be prosecuted. Then we had another homicide over on Millington near Columbus Avenue. We definitely have suspect in that case, and we are still in active investigation. We're continuing to pursue that case. We always said, it's word on the street is not enough. There's a difference between word on the street, a tip, and evidence. And so if you have the ability to help give us evidence and help bring the person that did this shooting to justice, please make sure that you reach out to our Mount Vernon PD. And the information for the Mount Vernon PD, we have a text-to-tip program, a tip-a-text program, and you would dial TIP 411 or 847-411. In the subject line, you would put MVPD, and then in the body of the text, you would text whatever your tip is. This is computer generated. It does not give us your phone number. We don't have your information. It is an anonymous opportunity for you to give information to the PD. But even better than texting a tip is coming in and sharing information with our investigative team so that we can bring the perpetrator to justice. We had another shooting yesterday down near our Bronx line here on the west side. Again, that was a domestic case, between, people in a relationship, and it got out of hand and there was a shooting. We've been able to solve that case, and that person is in custody. And then we had a fatal shooting last night, and that is an ongoing active investigation. So right now we have 2 open cases that we are investigating and that we need the community's help on. We can't do this without you, and that was our conversation on Sundays with Shawyn. Most of the shootings that have happened have been domestic cases, have happened inside people's home by people who knew each other and were in some type of either romantic relationship or roommate relationship or whatever, but there was an established relationship, and these were people that people let into their home, and things went south clearly, and a shooting occurred. We've had 2 community-based shootings, and like I said, those cases are still being investigated, and we need your help. In speaking with my police commissioner today, he is definitely doing some reorganization. We are strengthening our community partnerships, and we are reaching out to, some people don't like the term street generals. It doesn't mean that the people were gangbangers. They are the same as credible messengers or gatekeepers. These are people in the community who have relationships with the community, who have respect in the community, and who we are reaching out to for support. I'm going to lean in for a second because I'm trying to see if I have any questions. Malcolm, if you have questions for me, please put them in the chat box because I'm in my office doing this on my own today without any assistance. So I can't see any of the questions because my phone, I'm doing this through my phone, it's turned the other way. So I can't see anyone's questions right now. So Malcolm, if you could put those in there for me, that would be helpful. All right. So that's where we are right now. We definitely are not soft on crime. We are not looking to let anyone get away with doing anything in our community. We know that lives are valuable. We want to put an end to this gun violence. You know, people have asked us, is this all COVID related? Look, we know that people are stressed out. We know that people are stressed out. We know that people are tired of being home. We know that people are grieving because you've lost friends and family. We know that people are afraid because they don't want to get sick and die. We know that people are dealing with financial hardships because you've lost employment, whether you worked on the books or off the books, and you're trying to figure out what your future holds. But if you find that you are in a situation that you feel like you need to lash out and you need some help, please reach out to someone. The answer is not violence, and the answer is definitely not going out here in the community and trying to rob a store or rob people or mug people. There is help that is available. Times are tight. We are not denying that at all, but the way to get through these tough times is not by taking a gun and going out and shooting someone or beating anyone in your home, or beating your kids, or beating your wife, or beating your partners, or beating your husbands. That's not the way. Domestic violence is increasing not only in Mount Vernon, but all across the country because people are really stressed right now. But help is available and help is out there. So we are saying that if you are stressed, if you are overwhelmed, if you are worried about your future, we're all in a position right now where we just don't know what some of the future holds. Because we are dealing in unprecedented times. But please know that if you involve and engage yourself in criminal activity, that you can almost be rest assured that your future will include some type of incarceration or government supervision if it doesn't rise to the level of incarceration. So hold on, I have to lean forward because I have a question. Yes, so we do have a question about whether or not Mount Vernon will be distributing face masks to the community. So yes, we got, and we're still receiving a shipment of masks as well as hand sanitizers, and we will be distributing these on Friday here on the steps of City Hall. We will continue to follow social distancing, but if you come to City Hall on Friday between the hours of 3 p.m. and 7 p.m., we will be out here on City Hall Plaza handing out face masks for you and your family members. So please come and show up. We will also be going to our senior buildings and handing out face masks. We'll be sending face masks also to those who receive home delivered meals. We'll be giving out some face masks in the apartment buildings. And on Friday at the food distribution at the Dole Center, we will also be giving out face masks. And so wherever we're doing food distributions, we'll be giving out face masks, and we'll be doing a big face mask giveaway. The face masks that we're going to be giving away on Friday are white face masks. They are cloth. They have the little loops that you could wrap around the back of your ears, and they're washable. They're face masks that you could wash over and over again, and you just hang them and let them air dry overnight and wear it the next day. So these are reusable masks so that you don't have to go out and keep paying $1, $3, $5 for a mask. We will be giving out reusable masks on Friday, and we're expecting to give out about 10,000. So if people show up, we will have face masks to give away to you. The last thing I guess I want to just touch upon really quickly is the census. Mount Vernon, we still need your help with the census. I just had a meeting with some young leaders in the community, and I asked them if they had done the census, and they said, no, I didn't do it. I don't want people in my business, or I really don't know what it means. And once again, the census is connected to all of our census numbers, and us making sure that we have a complete count of everyone living in our community, whether you are a resident, whether you are 1 day old or 100 years old. We need to make sure that we count everyone in our community. And the way that that is done is through the census. And it's only done every 10 years. And all federal funds, $800 billion is given away every year by the federal government to states, to counties, and local municipalities for services like road resurfacing, so that we can fix the streets, for fixing of bridges and tunnels, for building of police and fire departments, for schools and education, for programs for youth and for seniors, for job training programs, mental health programs, employment placement programs, reentry programs, medical and Medicaid and Medicare, and medical services. The Neighborhood Health Center recently received a grant through Elliott Engel, and a lot of that had to do with the information that they got through the census about the number of people that lived in that community and how much services that we needed. So if we do not have everyone counted this year, we're going to lose out on a lot of money over the next 10 years, because that's the only time that they do the census, is once every 10 years. You can do it online at www.mycensus2020.gov. You can call the 1-800 number. It's 1-844-330-2020. I can't believe I remember that number, but it is 1-844-330-2020. Some of you may have finally received the census in the mail. The first thing that they did was try and get us to do it online, and then also do it over the phone. But when they didn't hear from people, they started mailing out the census. So some people have received it. People are also used to waiting on someone to knock on your door and ask you the questions. But with COVID, that may be something that does not happen this year, as no one may come and knock on your door to count you. And so we're asking that you take the initiative and that you go online, www.mycensus2020.gov, make a phone call between 7 a.m. and 2 a.m. at 1-844-330-2020, or if you have one that's been mailed to you, complete it, fill it out, and mail it back. You don't even have to put a stamp on there. Those are just some of the ways that you can handle that. And I think, guys, that's pretty much it for the night. We want to make sure that we continue to give condolences and to all of those people who have lost family members. We know that this is a very hard time. If you've lost a family member because you're not able, whether it's from COVID or anything else, we cannot have traditional funerals. Another thing that we know is very difficult is we have a lot of people who have family members in nursing home or who are in the hospitals for one reason or another. And because of COVID right now, there are no visiting privileges. And so you have to just continue to reach out and speak to the nurses at the nurses station, make phone calls for people who are in nursing homes. I know I've spoken to the Wartburg and to Sunrise, and they've been doing kind of FaceTime sessions or Zoom sessions so that family members can at least see their loved ones that are in the nursing homes. We don't have to feel like we have no power and no access. We just have to find ways to access people differently. Please continue to look at not only Mayor Shawyn Patterson Howard's social media pages, but also City of Mount Vernon at CMVNY. And that's on, Facebook, Instagram, and Twitter. You could also look at our Office of Emergency Management social media pages, our police department social media pages, or you can go right online to our webpage at www.cmvny.com, and you can get lots of updates on our website for the City of Mount Vernon. So Mount Vernon, for me, that's pretty much it for tonight. We had some guests, but they had to pull out, but we still just wanted to kind of come and give you a little bit of updates. Please know that we're still engaging our street generals, our credible messengers, and our gatekeepers, and we are activating them, and you will see people in the community that you know and love and respect reaching out to talk to our young people and some of our people who might be at risk or don't necessarily have the skills to negotiate challenges that they might be having in the community. Our police department is out there working. You will also see them doing more foot patrols and engaging people in the community because this is what we need to do. We need to do all of this together, Mount Vernon. The community can't do it by themselves. The government can't do it by ourselves. The police can't do it by themselves. But this is our community. If we want a safer community, then we all have to step up to the plate and make it safer for the entire community. Mount Vernon, as always, you know I love you guys. I appreciate you. Thank you so much for all of the encouraging words that you give. And even for those who criticize, I thank you for that too, because I do pay attention to constructive criticism. I take those things into advisement, and we continue to move along and move forward. I don't have to like what you say to hear what you say, and if it applies, then we're absolutely going to use it to make a difference. And that's pretty much it. Thanks again, everyone. Have a really, really great night, and take care. Be well.